Good morning, all of you. This is Dr. Vedavati K, a pediatrician. Today, I'll be sharing a few important points like what we should do before the schools are getting started after the summer vacations. So, we know kids will be enjoying during holidays and vacation, and they will be traveling to their home countries and all. So, once they come back and getting back to a school, it will be little difficulties they can face when they are not adjusted to the usual routine. It might take 1 to 2 weeks for us as well as a child to get adjusted to the usual school routine. So I'll give you a quick concerns which needs to be addressed before the child starts going to the school. Coming to the nutrition, we know balanced diet is very important. Try to make it home based diet and avoid junks, or at least minimize the junk and put it in the weekends. So ideally the child's diet should contain pulses, grains, vegetables, fruits, grains, as well as dairy products, and enough of water. Ensure that the child is drinking 1 to 1.5 liters of water along with the milk, dairy products and fruits and vegetables. That will give sufficient amount of the liquids which is required. Then coming to the sleep hygiene, we know during vacations the sleeping schedule will be little disturbed. So once we getting back to the school, we have to maintain a proper sleep hygiene so that the child is very attentive and can learn better in school and focus on the school activities. So make sure that the child sleep early in the night and get up in the early in the morning. So 6 to 8 hours of sleep which is not disturbed should be good for the child. So avoid like any conversation or caffeine containing things in the night, as well as the digital timing. All this needs to be avoided 2 hours prior to the sleeping hours, as well as the whatever the school work is there, that needs to be completed early in time so that the child sleeps well and gets up fresh in the morning. Then coming to the dental hygiene, it's very important because of caries and cavities, the child often misses school. So in order to avoid that, better the child brushes his teeth twice a daily, and flushing the mouth each time after eating some kind of sweets, chocolates, all this, and minimizing the sweets and chocolates will also help in improving the dental hygiene. Then coming to the digital timing or screen time. So few kids are like into the screen all the time during the vacations. So it's very difficult to stop the screen time at once. So before planning to send them to school, at least 1 to 2 weeks prior, start cutting their screen timings and start inducing the habit of reading, indoor games, and mixing with friends and group studies, group activities. All this will help the child to get used to the weaning of the screen time and then better focus in the school days. Then coming to the skincare routine. So we all follow good hand hygiene with the COVID, but then there is something needs to be done for the foot also, because we are seeing a lot of fungal infection in the feet. So as soon as a child comes from the school, the feet needs to be washed, made it dry, and apply some moisturizer. Leave it for aeration. No need to wear socks in the house. As well as make sure that you are trimming the nails every week, even the feet, and you also take deworming every 6 months. This will actually help in reducing the worm load and the anemia in the child. And what I've noticed is like there is chances of head lice in the children. So whenever you visit pediatrician, you can ask for lice treatment also. That will remove the lice from the head. As a result of it, the anemia burden on the children will also be reduced. And before I conclude, we can think of giving flu vaccines to the children, so that the frequency of upper respiratory tract infection, or what we call as cold, cough, all these flu symptoms will come down. As a result of it, the school absenteeism will also come down, and the frequent hospital visits will also be reduced, as well as a very severe cases of flu. Like, very rare it is, but we have data also. So this can also be avoided in children. Hope this will be very helpful for the parents before sending the kids to the school. So thank you.